Zoom recording. There we go. Does anybody see? Yeah, there's a little recording dot. All right. So welcome everyone to our April Genetic Ambassadors call for Mountain States Regional Genetics Network. Today's April 29th, 2020. I'm so glad you guys could all join us today. We have a jam-packed agenda. So I'm going to start off by doing some introductions. You guys, I think everybody knows me. I'm Christy Weiss. I'm the Consumer Engagement Director here at Mountain States, and happy to help if anybody has any needs currently. We're going to talk about that. We're going to start with introductions. We'll do some round robin introductions, but I have a question for everybody to answer today, which is, what has been your or the families you serve biggest challenge during COVID-19? And sorry, I misspelled COVID there. So if we can all answer that, because I'm really would love to hear from our region and the genetic ambassadors in our region, what are really you're hearing on the ground in your own communities and with the families that you serve, what's going on. So if there's any of those needs that we can, as Mountain States and as a region, address or come and help, walk beside you to help with, we would love to do that. So let's just start. We'll go round robin, and let's see, who wants to go first? Let me see who we've got. Daphne, you're first on my list. You want to go?
Boy, didn't I get lucky.
Go ahead.
Okay, so we have Ryan, who has vascular Ehlers-Danlos syndrome, and it just puts him very fragile, where he could, a sneeze could kill him. But his little brother, who's a baby, had to go in for his 1-year checkup. And it was terrifying to my daughter to take the baby to the doctor's office because she was afraid of COVID-19 because it's a respiratory infection, and she knew that it could be deadly. And so it took a while to put her at ease. And when I was doing that, I had 2 other families who had similar problems. Their kid needed to go in for something else. So it was just reassuring them that their physicians were trying to make it as safe as possible, and they still wanted to see their patients. Because I found out in most of the physician offices around here, patients aren't going in, not even for their cardiologist. If they suspect a heart attack, they'll stay home and chew up a couple of aspirins and just stay, not go. Mm-hmm. Because they're afraid of going to the doctor's office or of going to the ER due to COVID-19 exposure. Yeah. And most every place is taking great precautions to not mix the 2 populations.
Right. Thank you for sharing that, Daphne. I've heard some similar reports of people just not going in for really serious stuff that could be life-threatening too. Thank you, and we do have a guest on the line. So you're Daphne from Texas. So say where you're from, and then you can answer the question. All right, next I've got on here Heather. You're under Daphne.
All right. So ours has been similar.
You're Heather from Colorado.
Yes. Hi. I'm Heather from Colorado. Our experience has been similar to what you were saying, Daphne, in that. Patients just, they are 2 things. So appointments are getting canceled. They're moving to a telehealth environment where sometimes that's not optimal. Access to technology has been an issue. A lot of our patients have gone quiet, which is concerning in and of itself. I think people are just kind of huddling down. From serving our patients, we're trying to do what we can. We ship out ubiquinol, CoQ10. The hospital has kind of closed down to everything that's not essential, so no one was getting their CoQ10. So I now have a case of CoQ10 at my house that I'm shipping out for our families. So just things like that. Everything, people are not going to see their specialists if they don't have to. There's just that overall fear.
Yeah. Do you find like there's a big barrier to coming to terms or accepting the telehealth piece? Do you feel like there's some hesitation there with families because it's so new for some families?
I honestly think our patient group is excited
Okay.
about that.
That's good.
You know, I think, and again, it's the people that we're hearing from, right? So it's the people who have access to technology and people who understand it. So my concern is that underserved population who is just being quiet about it, we're not hearing from.
Yeah, and they might be struggling because of access or
exactly
understanding how to use it or something like that, and you're not hearing that from them.
And we're not. Yeah.
Okay.
I did just get off a call today with PCA Science, and all of their clinical trials right now, they're trying to move into a virtual environment.
Oh, wow. Okay.
Yeah. So I think changing times, but that's kind of what we're hearing.
Yeah. Thanks for sharing, Heather. Appreciate it. All right, Gina, do you want to share what's going on in Utah?
Hi, Gina from Utah. I think a lot of what was just said. The other piece is the babies being born, newborn screening has looked very different and very scary. Even within our family, we had a baby born, and the follow-up heel stick was a little bit challenging for trying to describe and explain gently that they still needed to go do it. And so she finally let Dad take babe, you know, because of the fear of exposure again. Right. No matter how well they love and trust their pediatrician, that was challenging. So I don't know if there's going to be more information about the delay in some of those newborn screenings. So that's a challenge. The other big thing that at least we're seeing here is because of the overload of doing schoolwork and the health appointments and all of that by Zoom or other platforms, the burnout and families feeling just like they are failing their children because they just can't keep up. And the mental health piece of it is huge right now for not only the kiddos, but for the families.
Parents too. We've heard about, so the concern you bring up about the newborn screening really only impacts our 2 screen states, which Arizona is one of them. And we've heard from them on our last state team call that there was a lot of concern about the second screens there and getting them done, and that they had seen a drop in numbers as well. Texas, I think, also reported seeing a little bit of a drop, not as drastic as it seemed like Arizona was reporting. But again, those numbers, I think we'll see down the road, you know, how those shake out during all of this for the second screen numbers. So thanks for sharing, Gina. All right, I've got Melissa next. Are you there, Melissa? I see you. It must be warm in Texas. You got a tank top on.
Yes, and I've got the air conditioner on. Still hadn't turned it back up from last night. I like sleeping cold.
Melissa from Texas, what's going on there?
I agree. You know, families are not wanting to go anywhere really, especially to doctor's offices, hospitals, things like that for screenings and whatnot. I work primarily with families who have a baby in the NICU, and I've gotten a lot of calls, a lot more than usual. You know, sometimes families reach out, sometimes they don't. My son Matthew here you may see him peek in. Oh, okay.
That's okay.
Curiosity solved. He's getting used to these. But families trying to find balance in, you know, helping their kids get online to do school, you know, just keeping some sort of a routine. And still, you know, a lot of families are working from home and they don't have help coming in right now.
Yeah.
Caregivers are not in the home because caregivers are exposed to things. We don't want our families exposed to things. Matthew and I are here most of the time, and we don't go much of anywhere. And if I do have to go somewhere, I don't want it to be somewhere where I have to bring Matthew in, so I'll do without.
Yeah.
And a lot of our families are experiencing that as well. It's just not wanting to expose their family members, being afraid.
Yeah. Thanks for sharing.
Mhm.
I've got Wynton up next. Wynton, I know you said you were going to be in the kitchen, but can you talk for a second? She was going to be making her.
Give me
Oh,
half a
there she
second.
is.
Let me,
No problem. You want me to go on to the next person and come back to you?
no, it's okay. I'm here. Hi.
Are you good? Okay. Here she is.
Hi.
Hey, Wynton. Wynton from New Mexico.
Sorry. Hi. So a lot of the things I've been hearing are the same for us here.
In New
There-
Mexico, right? You're in New Mexico, you're
Yes,
Albuquerque?
in New Mexico. What I've seen also is, I just want to take one case in point because it's been on my mind. We have a participant who I'm a MEVIA developmental disabilities waiver, kind of like a case manager. We call them consultants here. And one of my participants has a genetic condition, underlying medical issues or conditions. And so I found out like on Friday that the person had COVID-19, was having issues with breathing, but they had him the person stay at home. And then I kind of contacted the Medicaid care coordinator because I thought to myself, gee, if he's having trouble breathing, isn't doing so great, it might be a really good thing to have a pulse oximeter at home. So care coordinator tried to organize that, but then when I spoke with mom, it was denied because Medicaid doesn't cover that, even though the person was having the difficulty breathing. And we know now that it's a good kind of thing to keep an eye on, especially someone with underlying medical conditions. So then I learned that just like one night, the person wasn't breathing well, paramedics were called, checked the oxygen stats, they were okay. And then 2 days later, went to the doctor again, and oxygen was down in the 30s. So
Oh my gosh.
really bad spot to be, just like 2 days later. And I was thinking, well, no, 3 days later. And I was thinking, you know, if they had that oxygen pulse oximeter, maybe when it was in like the 80s, they would have spotted it, got him the help he needed. So obviously he was sent immediately from doctor to hospital, and is now in the hospital. But it makes me angry that, now that said, Medicaid did say, or this MCO did say, well, if you want to pay for it, you can pay for it out of pocket. And of course, mom said, yes, I will. But at that point, by the time they went through all the rigmarole, you know, that's when he wasn't doing well, went to the doctor, and then went in the hospital. So it makes me angry that we're not prepared to help our, you know, vulnerable populations, you know, in circumstances like this and in circumstances like others. So that's the one thing. And another is that a lot of my participants obviously can't get the help they need, because it's kind of like weighing, do I have the person come into my home to help me with the risk of contracting COVID-19? So kind of what I've been hearing in general. And then the next thing on my mind is having to do with genetic conditions, and what could be perceived often falsely as possible poor outcomes for length of life, and medical triage. So we haven't seen it yet that I'm aware of in New Mexico, but it is a worry, and I'd like to get together with to see what our hospital policies are in these conditions. So there you have it. That's me.
Thank you, Wynton. Thanks for sharing that story. That's heartbreaking. It sounds like if you would have known the outcome, you could have just said, if possible, just buy it and get reimbursed, but you don't know that until you go through all the hoops, right? To know that that's for people who can't just output the money for a $30 pulse ox, that's not an option.
Well, and not just, absolutely. But also when mom went with the participant to the doctor, I think it was over a week ago, and had the diagnosis. And knowing that, I mean, there was some kidney, underlying medical conditions. So that's a big red flag. In my opinion, the doctor's office should have been on it, instead of like, take him home. This is what was told. Take him home, give him Tylenol and cough syrup.
Oof.
it's kind of like, wait a minute, there's all these red flags that we know, I'm not even a medical professional, but that we know. And it just seemed like the doctor's office was, with the genetic condition, the other underlying medical issues, all set, prevention would have been the best cure here, I think. And it didn't happen. It didn't happen. So that really does distress me. Anyway, okay, I got to go back to the kitchen with my computer.
Okay, thanks for popping on.
I'll be here.
Thanks for listening. All right, and thanks for letting us know how you're doing. All right, I've got next Jamie. I think you're on. Are you on the phone, Jamie? I can't see you.
Yeah, I'm on the phone.
Go ahead, Jamie from Colorado.
So ditto. I'm Jamie from Colorado. Ditto what everybody else has said. Yeah. Just not wanting to take the kids out. I mean, they like to put their hands in their mouth and put other things in their mouth. I do like the telehealth. I like that platform. We've had numerous appointments that way. That's great. One of the great things about it is just because I don't have to worry about coordinating everything, getting a babysitter for the other child, driving all the way to Denver, having to wait for the appointment and then wait while the doctor's doing their thing. And it's just great. It's right there. It's distinct. I don't have to go anywhere. I don't have to do anything with the kids. But then for our pediatrician, we'll have to go in a couple of weeks for her yearly my daughter's yearly well child checkup. So I'm not too happy about that. But yeah, I think the main thing is having to balance work, the kids, all the very hot mess of online school. Yeah, when things start opening back up, do we trust the practitioners to come into the home? Because before COVID-19, I would have to send them home with the flu or with the stomach bug. They'd come in sick, and I'm like, what are you thinking? So if you can't trust them before COVID-19, how can you trust them now because they're wanting to get paid?
Right.
So, I mean, they don't want to get your family sick, but at the same time, they have bills to pay. So, yeah. So yeah, ditto for what everybody else has said.
Thanks, Jamie. Thanks for sharing. I saw Elvira on here. Elvira, are you on? I saw your name pop up and then it went away. Are you still on? Maybe not. Okay. And then I see Chris T. Chris and then a T. Chris, do you want to introduce yourself?
Hey, this is Chris Tippett.
Oh, hey, Chris Tippett.
Hello.
Go ahead.
I'm not sure what we're sharing.
Oh, sorry, you came on late. Sorry. We are sharing what has been your or your family's, the families you served's biggest challenge during COVID-19. And introduce yourself. You're Chris Tippett from Colorado, right?
I'm Chris Tippett from Colorado. I've got 10-year-old unaffected, 7-year-old affected. And the biggest challenge has been all of us staying in the house and trying not to kill each other.
Understood. Understood.
Hi, Chris. It's Heather Schichtel. It's good to hear your voice.
Sorry, my screen's going crazy here. Good. All right. Did I miss anybody? Thanks for being on, Chris. Appreciate it.
Good to see you.
Good
yeah,
to
hey,
see you.
Christy. This is Michaela from Colorado.
Oh, hey, Michaela. Sorry. Are you on the phone? I didn't see your name.
No. Yeah, I'm on the phone. Sorry, did I just interrupt someone?
Nope, you're good. Go ahead.
Okay, great. I would say that for me and my colleagues and some of the other families that I both work with and also, just friends, I think that now I'm seeing the biggest way that individuals are affected is in by way of mental health, and not just processing, everything that's going on to an extent with schooling and working from home or losing jobs, but also how to navigate this new world. And so if I was to, maybe suggest anything, would be for us to figure out a way to maybe provide a collection of resources to navigate the new environment we're about to step into. And maybe that's in a way of, options like telehealth options. Furthermore, I know so many including myself, I need a new crown on my tooth, like I have cavities, there's all these sorts of things that we've just kind of waited. Lily's due for a few specialist appointments, and, so can we do those telehealth, or will we have to go? Obviously, I can't get a crown telehealth, but you know what I mean?
Yeah.
I wish I could. If I could, I would totally do that. So the mental health aspect also of having, a kiddo with Ehlers-Danlos syndrome, and also trying to balance both keeping her safe, but not completely locked into our home for the next foreseeable future, and, navigating friendships and that kind of thing. And I do have to say that perhaps the biggest challenge that we've faced as a family is I lost my father on April 4th. And not only was I not able to be there with him when he died, my sister was the only one who barely was let in there with him. He did not pass of COVID. He passed of COPD. But then we have not been able to grieve as a family. We've not been able to get together. And so, there are things, in life that we experience, whether perhaps people have, lost pets during this time or loved ones, and nothing is the way it was. And so we're all navigating these new circumstances, and oftentimes, it's definitely, you feel really isolated anyway, and then to top it off with things like that.
I am so sorry for your loss.
I'm so sorry.
I have had
Thank
a friend also lose her dad last week to COVID, and shared a very similar story with me, that only her brother was able to go to the burial, and they had a virtual memorial service.
Yeah.
I'm so sorry.
Yep.
You're right, and nothing
Thank
is
you.
how it was before.
Right.
So thank you for sharing, Michaela. I think I saw Elvira come on. Elvira, are you there? She popped back on and now she's gone.
Hello,
there,
this is
Go ahead.
This is Kyle.
Oh, hi, Kyle. Go ahead. Do you want to introduce yourself for answering the question? What has been your family's you serve biggest challenge during COVID-19?
And so, what has been the biggest challenge for my family and I?
For your family or the families you serve. So you can introduce yourself. You're Kyle from New Mexico, right?
Yes. Yes. So good.
Go ahead.
Yes. Good afternoon, everybody. My name is Kyle, and I'm from the community of Shiprock, and I represent the Navajo Family Voices, and we perform the family circles in the area. And so the last time we did a genetics pop-up was on March 4th, and it was a success, but just acknowledging the COVID at that moment. I remember talking about it, viewing that it was spreading internationally, and just as of now, from what I've seen and heard from families, that COVID-19 has their full attention to, yes, it is extreme to go to the store. It's frightening to go to the hospital. So everything else as regarding their health has been put on a back burner. It's just mentioned that if you only have severe conditions, you're only allowed to go to the hospital. And I've heard much concern from families that do test positive or in quarantine that there's no shelter to go to. And so it's very difficult for family members who test positive and everybody's trying to quarantine. How can we help these families practice social distancing amongst each other? And so the schools are shut down, and so it's difficult for family members to continue with work, or one of them making the sacrifice. And so it's just very horrific how COVID-19 affects everybody on many levels, from financials to the family structure, and just kind of like their last thing on their mind is any other health effects. And so it's very tormenting to see. even as far as mothers who are pregnant, they are scared to go into the hospital. And so with the Navajo Nation, there's like over 1,500 positive cases in the area, and so and that's just my quick update. And even with much outreach for digital use, there's much problems. There's only like a quarter of families that have internet usage and have capabilities to seek out resources in that way. Thank you.
Thank you, Kyle, for that overview. I appreciate it. I know I saw an article just the other day about the percentage of cases in the Navajo Nation being kind of some of the highest density in the whole country because of the number of cases that they're reporting there. So thank you. I know we're working with Josie on connectivity with you guys, so and the New Mexico team. So thank you for sharing that. All right, did I miss anybody? I want to introduce our guest speaker, Emily. I know she's been patiently waiting on the line. Is there anybody else on the line that of our genetic ambassadors that would like to introduce themselves that I missed? I think I got everybody. Okay. All right, we're going to move on to our guest speaker, Dr. Emily Shelkowitz. I hope I'm saying that right. Is joining us from Colorado Children's Hospital, and she is working on a project for parent-friendly sheets given to families after a newborn screening condition has been identified. And so I wanted to let her talk about this project, and then she has a call for some volunteers to help. So I'm going to turn it over to her and let her introduce herself more fully, and then I'll let you share your screen if you want to show anything as well. Emily, can you hear me? Are you good?
Yeah.
Go ahead. There you go. I can hear you.
Can everyone hear me? Yeah.
Yeah.
So thanks to all of you for inviting me to join your meeting and allowing me to listen in on your reactions to how the past weeks have been affecting you, your families, your communities. I realized that was privileged information. So thanks for allowing me to join. My name's Emily Shelkowitz. Christy got it right.
Got it right.
I'm one of the genetics and metabolics fellows at Children's Hospital of Colorado. I'm one of the first year fellows, so I realized I don't think I know any of the ambassadors from Colorado yet, but maybe we'll meet in the future. I actually did my general pediatrics training in Colorado as well. So despite the fact that I'm originally from New Jersey, which is definitely not a mountain state, at least over the past 3 to 4 years, I've had the opportunity to have some insight into the more unique challenges that families and patients in this area face, particularly those who have the rare conditions and are further from tertiary and quaternary medical centers. So I really admire and appreciate everything that each of you in your organization is doing. So to move on to my project, I'm working with Erica Wright, who's one of the genetic counselors in the metabolics clinic at Children's, and who's also the newborn screening coordinator for Colorado. And our project is basically to improve the quality of the written handouts that are provided to primary care providers and to parents when a baby has a newborn screen that flags as positive. It sounded like most of you had some familiarity with newborn screening, but for any of you who don't, newborn screening is a public health initiative. It was actually started in the 1960s with the goal of screening for disorders that are treatable in order to identify them in the newborn period before babies and children become symptomatic. And since its implementation in the 1960s, it's expanded significantly. Colorado currently screens for about 45 disorders, and these include conditions that range from congenital heart disease, hearing loss, immunologic conditions, endocrine conditions, and then disorders of metabolism, which is the biggest category on the newborn screen and the aspect of it that I'm involved in. And so I can really only speak to the process for Colorado and Wyoming, which Colorado covers. But the way it works here is that the delivering hospitals collect the samples from babies and they send them over to the state lab. And the scientists in the state lab, which is run by the health department, run the screening tests, and then they'll report any results that flag outside of the set cutoffs to Erica. And either Erica or the fellow on call will contact the newborn's primary care provider to inform them of the result and the information and provide the PCP with instructions for next steps and follow-up directions and things of that nature. One of the things that I noticed in just my first 6, 7, 8-ish months of being on call is that a lot of times the general pediatricians and family practice doctors haven't heard of the condition that I'm calling them about, or maybe they've heard of it, but they hadn't really thought about it since medical school. So it can be challenging to explain to the providers what the condition is, what they need to be concerned about, what they need to tell the families to be concerned about. And it becomes even harder when you're relaying this information to somebody who's then going to play a game of telephone, so to speak, and call the families to have a secondary conversation with them about the results. So in order to help address this issue and hopefully improve the experience for primary care providers and parents, Erica and I decided to work on revising and updating the newborn screening handouts that are at this point national handouts created by the American College of Medical Genetics to make them more relevant to regional providers in Colorado and Wyoming. And we also decided that even more important was to create parent handouts, which some versions exist, but currently there aren't any simple one-page handouts that can be used as, after visit documents for families. And the goal of the handouts would be for primary care providers to use them as a starting point to have a conversation with families, and for families to have something that's easily accessible and a written document that reviews the important details for them to keep in mind over the coming weeks to days while they're waiting for results that either rule the diagnosis in or out. So really what we'd love is for whoever's interested. I know everyone right now has different time constraints and pressures related to coronavirus, but if anyone is interested, we'd love help reviewing the handouts. Ideally, we're creating handouts for every condition, but probably would just need help looking over a handful, maybe 5 or 10 at the most. I'll pull out a handout so that everyone can see how brief we'd like them to be. But the main details we want to convey on the handouts are, first, what a newborn screen is, since in my experience a lot of parents don't know that it's being drawn and have no idea what it is. A short summary of what the condition is that the baby's flagged for, and then next steps that the parents need to take, either regarding follow-up tests, when they should be concerned, calling their doctor, asking their doctor to call the metabolic doctor on call, and so forth. And we want your feedback on the format of the handouts, their length, how they're structured, if the language is accessible, and then if the content we're covering feels appropriate, too much, not enough, what else can we add, and then anything miscellaneous that you can think of. And that's pretty much it. I'll pull up a handout so you could see one of them. So we haven't gotten our creative hats on to make them look pretty yet, but let me see if I can zoom in a bit more. I'll just try to highlight, really what we're going for is the brief review of what the newborn screen is, really, short paragraph on the condition, and then trying to be as concise as possible about what parents have to do next, with the goal of providing information but not scaring parents or making this a really traumatic experience and process for them, knowing that it already is, but trying to minimize that as much as possible. See if I can figure out how to unshare my screen, which is always the hard part.
You see a button that says stop
There
sharing.
we go.
Red. Yeah, there you go.
But that's basically it. If anyone has questions, I'm happy to answer them, or recruit Erica to help if I can't answer it.
So
This is Heather.
Go ahead, Heather.
I was going to say I can absolutely take a look. It's ironic, I think, that we're talking about this now, because I know one thing we talked about at our conference is that the newborn screening process has a PR issue. And I think that's, it immediately instills fear and doubt. And I can't remember who talked about the baby that had to go back for a heel stick, and all of us kind of cringed because we know the anxiety around that. So I think if there's anything that we can do to make this process, it's a terrifying process, but the good news is that this is really one of the top, I can't remember the top 5 healthcare breakthroughs, and this saves lives. And we have many cases, many families who are on the board that are a testament to that. So I think there's a lot that we can do here.
So I put there on this screen, if you are interested in volunteering for this project and helping Emily out, if you guys can let me know by May 15th, and then I'll compile a list of emails and get those to Emily so she can communicate directly with you all that are willing to review them. Emily, I think it's okay if they're not in Colorado or Wyoming, right? You're okay with parents out within our region, but outside of the state of Colorado, correct?
Yeah, definitely happy for.
You're just kind of looking for a content view. Okay.
Yeah, happy for all the input. Potentially, if you're reviewing it and you think it's something that your state would benefit from it, you have our permission to share the idea and contact your local newborn screening programs about it.
That's great. And maybe it's something, I don't know, I haven't talked with Jan or Erica about this, but once they're done, maybe it's something we could share links to if I don't know if they'll be public or not, but on the Mountain States site, so that if others wanted to use it in the region, they could use the template. Thank you so much for sharing. Does anybody have any other questions for Emily? Go ahead, Daphne.
This is Daphne. I'm going to have a question or something to say. Emily, do you want help on a university level? We create parent educational handouts for Texas Children's Hospital. And I teach health communications. I'm a health educator by training and by vocation, just about. And we've created some really good ones, and we would love to work with you on some of these. I'm looking for class projects for the fall. I can send you some examples of what we've done. Everything was supposed to be online. They were supposed to get through our legal system. They went to Texas Children's and University of Washington to check. We're working with Vascular Ehlers-Danlos for these first ones. And now they went to our legal, but with COVID-19, it's kind of tossed and turned. Things are kind of, who knows when they'll be up. So I'm hoping June. I know better than to ask for May, so I'm just hoping June. But if you would like to work with us or send it to me, I can show you what we've done. We even work with the graphic arts department to develop our own graphics and stuff like that. And we can also have them translated into Spanish by certified Spanish interpreters, because we have a bilingual health program at our university also.
Thanks, Daphne. That's great, and I appreciate you're speaking up. I'm sure that I'll have to speak with Erica, but I'm sure that we'd love your help in any form that you or your colleagues are able to provide. Maybe I'll have Christy connect us, and that way I'll have your email, and I'll just follow up, and we could talk about how you could get involved. So thank you.
That's great. Like I said, we are looking for projects for the fall. I think we've done everything we can possibly do with Vascular Ehlers-Danlos like 5 or 6 times, and everything you could possibly ever want to imagine, even to, do we pull a child's teeth with Vascular Ehlers-Danlos? So we've had just about everything. done. So yeah, I am looking for projects for next year.
Yeah.
Great.
Great.
Thank you.
Thanks.
Anyone
And then,
else have any other questions? Go ahead.
yeah, this is Michaela from Colorado. And also, I just wanted to add, I was wondering, whenever you get to the point, if you're interested, I am a member of the Family Advisory Council at Children's. And, you know, we would love to take a look at documents that you might have prior to finalization. If you want any input from any of us, we would definitely be willing to do that for you.
Yeah, definitely. Well, that'd be a great thing to, you know, have the parent advisor group involved in. So thanks for that.
I've got Heather, Daphne, and Michaela as interested, but if anybody else is on the line and wants more details or wants to talk with me about it or get in contact for more details with Emily, just send me an email. I'll have my email at the end of the presentation, but to contact me, and then I can compile all those. But I've got Heather, Daphne, and Michaela for sure as connections. Okay. Anybody else? Thank you so much, Emily.
Yeah.
Good luck with your project. I can't wait to see the results of it. Thank you for taking on this monumental task, because it's a big one to do all those, but I think it's really needed.
Yeah, I think it's important. Well, thanks everyone for letting me join.
Sure. You're welcome to stay on if you want. We're going to go over some other things about COVID and stuff. You're welcome to stay on, or if you have to run, we totally understand.
I'll probably listen, and I might just, you know, block my screen. But thanks everyone, and, you know, stay sane and healthy the best that you can for the next couple months.
You too. Thanks for presenting today. I appreciate it. All right, I'm just going back to the agenda here. I'm going to move to the COVID-19 resources because I want to share that with you, and a couple other things with Public Health Genetics Week. So I'm going to go forward here. So last month we talked about putting some resources on our website, and then these state-specific COVID-19 resource sheets. And those of you that are on the call that are part of the state teams in Mountain States, I just want to say kudos to you all, and thank you so much for all of your feedback and input. The state sheets are done for every single state in our region. I've got three screens here of snapshots of all of them. So there's Colorado, Texas, and New Mexico's. There's Arizona, Nevada's, and Utah's. And we just finished up with Wyoming and Montana's last week. And I'm going to show you where you can find all of these because they are all linked on the Mountain States website. So the easiest way is just to go to mountainstatesgenetics.org, and that clickable map on the very front page, just click on the state, which COVID sheet you're looking for, and it will take you, this is an example of Texas, it will take you to the Texas state team page, which the state teams have built out with links that are important for families navigating services for a child or a loved one with genetic condition. And at the top of each state page in red, it is hyperlinked, COVID-19 resources for families with genetic conditions in Texas. And then there's a thumbnail there as well of the sheet. And if you click on the thumbnail, it will open the PDF. So either the red link or the clicking on the picture will open the PDF. And then it's ready for download, printing, whatever you want to do with it. Emailing it. We've just asked if you are going to share it, if you can actually share the link, because then we're actually able to capture how many people download the resource rather than downloading the resource as a PDF and attaching it to an email. Unfortunately, then we can't gather the impact of that. But if you share the link, we're actually able to gather that through Google Analytics. So those are all up and ready to go. I just appreciate everybody's feedback so much on those and the state team's efforts on those. So does anybody have any questions on the COVID sheets before I move on? Nope, okay. All right, and then I wanted to give you guys another opportunity. We had Emily's great opportunity for help with those sheets for newborn screening. This is another opportunity for family involvement. The National Coordinating Center is doing something called Public Health Genetics Week. It's gonna be the last week of May 26th through 29th. This is a brand new awareness week. They're just launching it this year. And so that is the website there. It's being built out as we speak. So things are being added to it probably daily. But it's PHGW, publichealthgeneticsweek.org. As I said, the National Coordinating Center of all the regional genetics networks is coordinating this effort. And they are looking for consumer and family volunteers to answer some of these questions online in a video format. They are going to be editing the video and then doing a Facebook Live, kind of like how we do it, where we pre-record and then do a Facebook Live. So things like, how did you learn about public health genetics? How has public health genetics impacted you or your child's life? What is public health? Why is public health genetics important? And how would you describe public health genetics to a family or individual who was unfamiliar with that? So if anybody has a story that they would like to share or connection, sometime I'm on the steering committee for this group with National Coordinating Center. So we've had about 2 or 3 discussions about how do you even define public health genetics. So if the term is a little bit foreign to you, what they're really talking about here are things like newborn screening, things like universal screening for breast cancer or Lynch syndrome. They're really looking at things that are impacting at the state or federal level for genetics. And the reason the creation of this week was made was because there is another week called Clinical Genetics Week or Medical Genetics Week that's usually in coordination with the American College of Medical Genetics meeting. And they felt that Awareness Week didn't really capture all of those involved with genetics. It was really only focusing on those that were in the clinic and not this whole public health aspects of genetics. And so that's why this week was created, to kind of raise awareness for those working in the public health system. So they're hopefully recording late next week, because if you look at the timeline, it is going to be happening the last week of May. So they're trying to get that recorded and edited so it can be played the last week of May. So if you are interested, please reach out to me and let me know if you'd be interested in going on tape, on video, to answer some of those questions in an interview with Megan from National Coordinating Center. Exciting stuff. Our Nevada team is going to be doing an online career event that week too. So they're getting involved with it and doing a Careers in Public Health Genetics Week brochure. So stay tuned to the Mountain States Facebook page for some more information about that. Does anybody have any questions about that, about Public Health Genetics Week for me? Nope. All right, I want to let you guys know about 2 things coming up this weekend. We are going virtual with our genetics pop-ups, and I want to thank Jamie, who's on the phone, and Elysian, I don't think she's on today, but from Texas, for pushing the limits and pushing us outside the box of genetic pop-ups in person and going virtual. So both these ladies had been awarded pop-ups and had them planned for April and May, and had in-person events planned, and due to COVID have had to go online with those events. And when I reached out to them, they were interested in trying to do a pop-up virtually as well. So what we've come up with, and we'll see how it goes, and then we're in a test phase, we're in a kind of a guinea pig phase, so I appreciate these ladies being willing to roll with the punches as we figure this out. I recorded this week a virtual video, if you will. It's about a 17-minute video about the resources that come in the Gene in a Box. For those of you who are on the line that have had an in-person pop-up, know we send you a box full of all sorts of genetic resources. I took the top 5 with asking some people what their favorite resources were. I took the top 5 and highlighted those in this video. And so this video, I'm excited about it because it's not just meant for these 2 ladies. It can be used for other pop-ups as we go forward, and virtual ones. But it's an overview of the top 5 genetic resources for families, and then shows them where they can find more resources on our website. So that is ready to go. Elysian is doing hers, I believe, on May 2nd in conjunction with their sickle cell conference that they are doing online. And Jamie is doing hers on May 3rd in conjunction with her event that she was going to have live with a film showing. So Jamie, I know you're on. So do you want to tell people if they're interested in joining this weekend, how they can do that? Or do you want me to?
Sure. Yes, so I have to quickly look up the exact website because it's not, unless you remember it off the top of your head.
The easiest way for me that I find it is I just go to Eventbrite and then type in genetics pop-up. I think is the way I've found it before, that it pops up. But
okay.
We have it linked. Go ahead.
So it's Kinetic Connection Online 2020.eventbrite.com.
Okay.
So Kinetic is KINETIC, and then Connection Online 2020.eventbrite.com. And so it's a film showing of, it's the genetics pop-up. So I'll be doing a very quick intro with genetics. Mountain States has meant to me, and then Christy's video of the introduction to the materials, the resource materials from the box, and then Q&A, genetics pop-up Q&A, and then I'll be showing a free movie of A Life Unbound, which is a film about the Anat-Ben-Yael method, neuromovement. So it, I think it's a good time to show that movie because the method's about connecting with your kiddos and people who have needs in working with them. There's 9 essentials, and using those 9 essentials for learning and connecting. So, and there's we're having issues with the connection at the moment since we're so disconnected, being quarantined at the moment. So, and we're so overloaded. So, yeah, so that's what the film is about, is a couple of families. One is an adult, a Dallas Cowboy cheerleader who had a stroke from birth control pills and found the method, and it's really changed her life. And then a family who had a child with CP. So it's not a genetics thing, but children and people with genetics are definitely served by neuromovement practitioners. But just, you know, the different expectations and how things change and how you learn to connect with your children, and you know, people who end up having health crises and moving forward, how to you know, help them.
Great, thank you.
And
thank you for sharing, Jamie. And so if anybody's interested in joining that online, they can, we have an event for it on our Facebook page on Mountain States, and you can, and the link is there that you can sign up. Thanks, Jamie.
Yep. All
right, and I'm quickly going to go through the calendar. I know we just have a few minutes left. Heather's pop-up, I'm so sad, had to get postponed, probably for another grant cycle, fingers crossed. And the Miracles for Mido Grand Rounds was canceled. But for May, we have some stuff going on, the 2 pop-ups that I mentioned. And I wanted to let you know, Aurelia Brown just contacted me this morning from Parent to Parent USA and let me know of a webinar that's coming up on May 13th. I'll be posting this on the Facebook page with the registration link probably tomorrow. But it's coming up on May 13th, and it's highlighting support offerings from Parent to Parent USA and its members. So it's a great time for this in the midst of COVID-19, how family to family support can really help. So that is coming up. It's a national presentation. They're doing it with the National Genetics Education and Family Support Center out of Genetic Alliance. So I will share that again. Here's the details of it, but the registration is not linked there. So I will put that on the Facebook page. The Living Rare, Living Stronger in Cleveland, Ohio, I did just check. That's still slated for July 18th was the rescheduled date for that. And as everyone knows, the last day of our current grant cycle is May 31st for Mountain States. Going into June, these are the things that, as far as I know, are still on the calendar. Global Genes in September and the Montana Transition Conference in November. As you guys hear of things, if things are changed or whatever, please let me know and I'll update this. All right, last but not least, just wanted to remind everybody where you can find the Genetic Ambassador information. It's under the For Families tab. There's also the genetics pop-ups information, and we are doing our last Your Genetics Questions Answered. If anybody missed January, it was Heather. Heather was our January Your Genetics Questions Answered. That's been archived on the website, so you can find that under the For Families tab if you guys missed that on our Facebook Live. Thank you, Heather, for doing that. You did an awesome job. And this is our last but not least Genetic Ambassador call for May for this grant cycle. I have it scheduled for May 26th at 2 p.m. if you want to mark that on your calendar. We are going to be having somebody talk about newborn screening education series that has come out of Genetic Alliance, and Annie is going to talk about that. So we'll have her on as a guest speaker about this online module for education for families about newborn screening. And that's not specifically for families who have tested positive. That's a PR piece, Heather, about getting people to know about it before they have the baby. So pretty excited about having her come on and talk. All right, and I want to let you guys know we reached 1,000 likes on the Mountain States page. So thank you guys all. We're 1,003. I appreciate all your help with that. Just a reminder, if you do want to invite some friends, you go under the community tab and there's an invite friends button there, and you can invite people that you might know that would like to like the page. And just a reminder too, we have the Genetic Ambassador Program Facebook page. So if you guys are not in there and you would like me to add you, please let me know. All right, that's the end. There's my contact information. Remember, if you are interested in Emily's project or the Public Health Genetics Week project, please reach out to me, send me an email so I can make sure and get you connected with those folks. As far as the COVID stuff that you shared, if you have any specific ideas, I know a lot of people said, I heard the same thing, similar themes being said from everybody that reported, but if there's a specific solution that you have in mind that Mountain States can help with, send me an email about that too, so we can talk offline and brainstorm about that. Yeah, Heather, you have an idea?
Oh, I gotta run. See ya.
Oh, you gotta run. Okay. Thank you all. I know it's top of the hour, so I'm gonna let everybody go. But thanks for joining us today. Stay safe. Stay sane, and let us reach out if there's anything Mountain States can do to help in your communities.
Take care,
Bye.
Christy.
Bye bye.
Thanks, Christy.
See you guys. Bye bye. Thanks for joining. Bye bye.